Hello, everybody. Welcome to the Hey RX Friends We Got This podcast, where we share our thoughts on the pharmacy profession, experience as healthcare providers, and explore our identities as two women of color going after it all.
Yeah, as we share our story, we hope you laugh, maybe cry, and feel inspired as you get to know us. Because at the end of the day, we got this.
We got this. I don't know what happened, but I feel like I got a second wind. I have like all this like energy all of a sudden.
Do you really?
I'm like, hello, let's do this.
Hello,
Maybe because I'm
everybody.
really excited for this episode.
Me too. I'm excited.
It's gonna be a fun one.
This is different. This is different today.
Okay, so for today, we are going to be reacting to fun, pharmacy-related, professionally what am I trying to say? We're just going to be reacting to fun content online. As content creators, we're reacting to other creators, and we are going to have a good time just laughing and discussing and, you know, doing the whole thing, feeling inspired and everything.
Yeah. I'm excited.
Okay, so let's just jump right into it. Oh, but before we get started and all the fun, my name is Thu.
Hi, everybody. This is Saley.
And we are so happy to have you join us. If you are watching on YouTube, please share your thoughts and comments below. Let us know what you think about some of these crazy videos, because Saleh and I share videos all the time back and forth, and we are just consuming content as much as you are as well. So let us know your thoughts. And if you're listening on Spotify or Apple Podcasts or on a streaming platform, please rate, review, and follow us and let us know that you're there so that we can feel more encouraged to keep going,
Yes. We know y'all love us. We can tell, we sense it. We just need y'all to hit the subscription button too. But we want you to show the subscription button. We want the subscription button to feel a little bit of love too.
Yeah. So hit it now. All right. So this first one, I'm excited for you to see this because I don't think you have. There is this comedian. And now let me just preface that I do love this comedian. His name is Matteo Lane. I do find him very funny. But he has this whole bit about pharmacy, and I'm excited to have you watch it. Okay, ready?
Okay, go ahead.
Okay. All right. So this is Matteo Lane, and he's going to be talking a little bit about what he thinks about pharmacy.
Just went over this. Also, can we talk about really fake jobs and not forget Starbucks? Fakest job in the world, a pharmacist. Pharmacist. Why are you wearing a lab coat? There is no science happening back there. There's no chemistry. You're not.
Hold on. Sally's already like, wait a minute.
Time out. I'll have you know. There's grade 1A science happening back there, Mr. Matteo. Like, why are you wearing a lab coat? There's no science going on.
Jurassic Park, you're not creating new dinosaurs. You're in the lowest form of drag. And also, am I wrong? Welcome to the stage, Pharmacist. It's just so annoying. And one time I was bitching about Pharmacist, and then this woman stood up, and of course I was in Ohio, and she was like, I went to 6 years of pharmacy school. I was like, what did you do for 6 years in pharmacy school? Did you just put on a lab coat, and then your teacher's like, all right, everyone. How many pills do you see? So embarrassing.
Okay, I think that was the end of the joke. Oh my God, he said that you are in the lowest form of drag. Like, I'm dead. Drag queens are offended everywhere. That's the one. It's like you're in the lowest form of drag. And
but you know what?
I'm such a Drag Race fan. All these things are going through my mind.
I do love that joke for the drag joke. I also love drag queens, so I'm just like, that is so interesting to compare to completely.
Because we're wearing
the comparison.
I know.
But you know what? I think it's fun to laugh at this. If you're not laughing, then you're crying. And what's fun about crying? So yeah. So I thought that one was interesting. Let's do this one. I have a whole playlist that I've saved. for every non-pharmacist content that is about pharmacy out there.
Oh my gosh, let me see.
This one is a ER nurse versus pharmacist.
Oh boy.
Richard. Hi.
Why does the pharmacist have to look so like prissy?
I'm like, I'm already mad. I'm already mad. Why is the pharmacist coming in so hot, Richard?
And with his lab coat.
With his lab coat. He's coming in drag and saying, Richard. That's literally
Ronnie,
all
how's
I'm ever
pharmacy
going to
life?
see now.
Your patient's getting admitted. They need their medications updated. You mean our patient is getting admitted and needs their medications updated, right? Either one of us could do it, you know. We'll see. Hey, can one of you verify Bed 2's meds? He will. Okay, maybe you two can work on it together. She has a whole purse full of loose pills. I can't even tell what's what. She didn't bring a list with her? Nope. Good luck. Well, let me know if you have any questions. Whoa. This seems like a pretty complicated list of medications. Don't you think a pharmacist is needed? I mean, drugs are your specialty. Oh no, the key to an accurate list of medications is communication. And you, Nurse Richard, are the expert at good patient communication. Goodbye. Bye.
The passive aggressiveness is strong on that pharmacy character.
Goodbye.
Goodbye. Good luck.
You are the expert.
But if you want to get better at communicating with patients, you should start right here with this one. I don't have time for chit-chat, Rich. I have to go mix drips for a very sick patient in 12. I'm getting a new patient, so it looks like I'm busy too. Oh, hey, Rich, don't worry about that patient. They're going to a different hospital. What? Oh, and Ronnie, don't worry about the drips in bed 12. The patient's dead. What? Family pull the plug. Don't forget to verify the meds in bed 2, guys. So,
wow.
It looks like we both have time now.
All of a sudden.
Yeah.
Because while you stood there bickering back and forth, patient care was still going on.
Yeah.
Patient care was still happening while y'all were standing there bickering back and forth. And also, notice Richard went from Richard to Rich.
that is a tiny detail that I didn't really catch. Yeah.
Richard became rich very quickly,
very fast,
very quickly.
The idea of med rec, right? Like medication history at admission. This is the problem. Like, this is not an uncommon conversation. It's like, who is supposed to be doing this? Because when a patient does come in with like 6 million loose pills and no medication list, who's going to be doing that?
They are eager. They're like, this is as far as I go. Loose pills, take it to pharmacy.
Nobody wants to touch that. Like,
no one wants to touch it.
We're like, okay, this is a lost cause.
Oh
man, I do not miss that. But yeah. Anyways, okay, what else do we got? This is an oldie, but I think it's hilarious. So this one's very dramatic, and I love this one.
Hello. Hey, this is Dan with Pharmacy. You ordered.
Oh, and the caption on this video is medical intern calling pharmacy.
Okay.
Vancomycin for Jones in 2319? Yeah. What's the indication? Possible hospital-acquired pneumonia. Are you okay with me adjusting the dose for his kidney function? Yeah, please do. Thanks for checking in. Oh, I'm not done. What? I'm not nearly finished with you. Excuse me?
Why is pharmacy so scary?
Oh, I'm not done.
I'm not done with you.
It's the sound of dun dun. But you're not done?
It's the music.
He ordered Jones's home statin, but he has LFT elevations. It should be held. Actually, I've read a few different things about that. Let me hold it. Okay. And you reordered his home eye drops, but I called his outpatient pharmacy and he hasn't refilled that prescription in months. Did you ask him whether he's still using them? Or I could just discontinue them. Let's just do that. And you ordered IV flagyl. I assume you know it has equivalent oral bioavailability. Yeah. I've switched it to PO. Okay, thanks. Now I really have to go. You're not getting off that easy. You reordered a blood thinner without giving any indication as to when his last dose was. I know, Don't you dare roll your eyes at me! What is happening? You should bow before me. Where are you? And you dare to order him melatonin, the most controversial and expensive medication known to mankind? You can discontinue and I'm sorry. Please just let me be. You can adjust any meds you want. Okay, great. Thanks. Have a good one.
Let me tell you about when I had something similar to this happen to me, right? I just started in my internal medicine service and I would go to rounds and have all these recommendations. And during COVID, we went to like virtual rounds and all the providers were like, just text me the recommendations. And I would text the providers like for room 1, and it would be like, number 1, DVT prophylaxis. Number 2, this. Number 4, this is this. Number 5, this. The first time I text that to the attendee, he texts me back. He's like, good Lord, just do it all.
Yeah. No, but you love it when you develop a relationship with a provider enough to like, you do send them like a paragraph. You're like, by the way, like due to this, and because of this, and study has shown this, and blah, blah, blah. And they'll just like they come to you at your office and like, just do whatever you want. Like, I don't care anymore. Please just do it.
I'll never forget. He's like, good Lord, just do it all. I was like, no, that's not how this works. Like, part of my insurance policy is that you actually look into what I'm telling you to do and we move forward together. And he's like, no, I mean it. I looked at it and it's spot on. I was like, oh, you looked, right? Like, me still like just making sure, like because it was just one line, like, good Lord, just do it all. I was dying laughing.
Man,
the text was so long.
The doctors, they need us, This is why they need us, but what I do love about that is the drama, the intensity of
all the pizzazz. It's like, I'm not done with you yet.
Yes, we are not done. Okay, let's do this one. This creator, she is not in healthcare at all, and she does this whole series where she does a whole series where she does a lot of like the office lady who doesn't care if you live or die kind of thing, like the hostess who doesn't care if you live or die, the airplane people who doesn't care if you live or die. So in this one, it's the pharmacist who doesn't care if you live or die, and she is in a lab coat. Apparently, that is our drag. That is our costume.
She's in drag.
She is in drag. Okay, let's go.
It was disgusting. It was like repulsive, but I couldn't look away. I know. Hi, are you picking up? What's the date of birth? Did you say 84? There you are. Are you picking up your medication for your bacterial vaginitis or for your foot fungus? Both? Okay. Do we have those ready? Thank you. Have you used these medications?
What? First of all, any patient would have jumped over to slap you. This for your bacterial vaginitis. Excuse me? It's for me to know and for you to mind your business. Just put it in a bag.
Yeah. Oh my gosh. Wait, have you ever worked retail or community at all? Probably as a student, right?
On rotation.
Me too. Okay. Yeah. Have you ever had these types of conversations with people?
No, it's
interesting. Me neither.
Like, have you used it before? Would you have questions for the pharmacist? But it's like, not straight up calling out indications and like, what?
I know.
They will yank you from that front row so quickly, like, here, to the back, to the back.
No.
And I love that she's in drag. I'm never calling the white coat again.
It's drag, baby. It's pharmacy drag. Okay.
Yes. Before a lot. Well, just a pea-sized amount on your vagina and a pea-sized amount on your foot. Try not to get those mixed up. Do you have any questions for me? Wonderful. Here you go. Have a happy, healthy day. No.
Sally's losing it.
It's the counseling that I just loved. It's the counseling. Oh, I'm
Try
done.
not
It's
to
like,
mess that up.
for me. No, okay. Moving right along.
Oh my gosh. Yeah, that's a good one. You
Yeah.
know what's actually that this reel does remind me. So when I used to work for this health system, it was actually required for employees of the healthcare system to use the healthcare's pharmacies.
Yeah. It
Okay,
was cheaper and stuff
so
and all that.
I worked in a hospital where it had an outpatient pharmacy, and I would get my prescriptions filled at that outpatient pharmacy, but I also work with the outpatient pharmacists.
Oh, no. See,
And
no.
so, no, let me tell you. Okay, this is TMI, whatever. But okay, so I was getting birth control filled there.
Yeah.
And I was trying out a couple of different types of birth control. And so I had gotten one version of this birth control, and then we switched me to a different birth control. And the pharmacist that was filling my prescription actually Teams messaged me. It was like, "Did you know that the provider is giving you another medication?"
Oh.
And I was like, "I don't know how to feel about this. I don't know what's happening. This feels
No.
really weird to me."
It's
But he
very
Teams messaged
weird.
me. I'm like, "Shouldn't you like call me like a real patient?" Like,
Yeah, you have to treat me like a real patient, even when we work together. You can't text my personal cell phone to be like, "Hey, your doctor just sent over
a
your
different,
medication."
yeah.
No.
I was like, I don't know how to feel about this. This is a strange like privacy, evading a privacy, but also you are also my pharmacist, but you're also my coworker, and we're kind of friends. This is very
These lines
strange.
are blurring.
The lines are
very
blurring.
blurring.
Also, because they had wanted us to fill our prescriptions at the outpatient pharmacy, they also wanted us to go to the clinics for just like primary care checkups as well. So, like doctors that I've worked with in the hospital, I've also gone as a patient.
No.
Yes.
Wow.
Especially because of COVID, they sent a lot of clinic providers to the hospital. So
Yeah,
I had after I got COVID, I got asthma status post COVID, and I got a primary care. I went to my primary care, and we worked together in the hospital. And he became my primary care, and I somewhat trusted him. But there was also another conversation about, and sorry for all these things, but Pap smears. And he was like trying to bring up, Pap smears, and he like made it all awkward about it. He was like,
Of course it
so
would be. Of
so he's
course
like,
it would be awkward.
when was the last time you got your Pap smear? And I was like, this is so uncomfortable.
So it's like, no, I'm not doing this.
I
I'm
can't
out
do
of
this.
here. I am out of here.
I can't do this. Yeah.
No.
Mm-mm. All right, next
Oh,
video.
wow.
Isn't that so bizarre? It's just like so many
That's
strange.
really, I mean, I think I ran into like one of my doctors at the club.
Oh,
And I was like, Dr. So-and-so?
wait,
And
were you a resident or what? Like, where were you?
No, I was
Like you were like a practicing pharmacist?
no, I was a resident in Philly,
Mm-hmm.
and he was like my doctor.
You're
And
like physician? Like your
physician,
primary
like,
care type of thing?
no, like for my transplant stuff.
Oh, okay.
But I knew he's young, but then I didn't know how to feel. I was like, why am I hanging out in the same places as him? Or maybe is it, why are you hanging out in the same places as me? Is it the other way around? Is
That's
this
so
the other way around? But it was like, I think I was trying to make it awkward and he wouldn't let it be,
yeah.
which I
Yeah.
appreciated. Because I was like, Dr. Such and Such. And he was like, oh, hey, what's
I
going
mean,
on? Are you having fun? And I was like, yeah, okay, bye.
I
He's
don't, I
like, oh
don't.
no, don't be like that. Come get a drink.
Oh,
I was
that's
like,
amazing.
cranberry juice, because I'm not gonna let my doctor know that I am consuming alcohol.
Right. I'm a good girl. What are you talking about?
Cranberry juice, please. I'm a good patient.
Just water for me, thank you.
Water for me.
Gotta get those kidneys, healthy and good function. Yeah, good shape.
Mm-hmm.
I don't mean to make this even more TMI, but one time, my gynecologist was my yoga instructor. I walk into the yoga studio and I walk into the yoga studio and I looked at her and she looked at me and I was like staring at her and she's like, "Do I look familiar to you?" And I was like, "Yes, but I can't figure out where or why or how." And then it clicked. And she was like, "We don't have to make it awkward."
I am squealing. I cannot breathe. Oh my God.
The things that happen.
I am picturing you just going through all your Rolodex of memories. Like, where do I know you from?
I was like, "You kind of look familiar, but different setting. I cannot put your face."
Wow. That's kind of
so
cool that
wild?
she's a yoga instructor.
It is
could've just
cool.
you could have done your cool thing a couple cities over and didn't need to be here.
No, but she was a couple of cities over, kind of. It was just because she works in Phoenix, but she lives in Chandler, which was where I was going to yoga at the time. And so it is like a 40-minute drive. And I was like, you have to drive that far to your practice? But yeah, you wouldn't expect it. But there she was checking me in.
Only in Thu's life, I'm telling you.
I sometimes think that I'm psychic, Saley.
Oh, here we go.
We'll have to talk about it another time. Okay, let's do this next one. This is one called Intern's First Order.
Oh boy.
This is by Dr. Glockenflocken, who's one of my favorite creators.
Dr. What?
Pharmacy. Hi.
Ooh,
I just I put an order in for a medication, for a patient, and I just wanted to just call and make sure it was okay. Oh, sure, no problem. What's the patient's last name? Carver? Okay, let's see here. Ah, is this your first order? Yeah, actually, I'm a new intern. How did you know? Well, you're calling a pharmacist to make sure it's okay that you ordered Tylenol. Oh, yeah, sorry. Hey, no need to apologize, all right? I'm happy to help. Let's take a look. Okay, so did you mean to order a suppository? Oh, no, definitely not. Okay, because you ordered a liquid suspension and it'd be hard to shoot it up there. Yeah, that makes sense. Oh, I see what you did. You want to order it PRN instead of PR. That's per rectum. Okay. Thanks. Also, did you want to schedule that every 4 hours? No, I don't think so. Yeah, Tylenol suspension delivered every 4 hours per rectum might irritate the nurses a little bit. Okay, how about every 6 hours by mouth as needed? That's a great order, Doc. All right, I'll make the changes for you. Thanks.
He is so nice. Look at the positive reinforcement. That is a great plan, Doc. Let's go with that. Even though you just try to give someone a suspension per rectum, and we're gonna forget that ever happened.
I would say also, like, button up with glasses is another pharmacy drag.
Yes. Drag, yes, again. It's also like the thing that's just telltale sign here is pharmacy. When I'm with students,
I know.
I'm like, you do not, whatever you do, you cannot answer the clinic's phone with pharmacy, because I'm highly irritated when I'm on rounds and providers are like, pharmacy, any questions? Oh, hey, my name is Saley.
Excuse you.
I am not a pharmacy. Hey, my name is Saley. And I always because I just think that some providers don't bother. They don't bother to learn. They know the social worker's name. They know the nurse's name. They know the nurses are changing every other day, but they know the nurse's name. I've been showing up to these rounds every single day. Yeah, I need you to make the effort to know what my name is.
Yeah. It's like, pharmacy, are you here? Nope, no pharmacy here.
No pharmacy here.
Don't
but
see a pharmacy.
I'm
a
the
pharmacist
on this team, and I'm happy to help. But like,
yeah.
what? So
That's a
don't
good
answer the
point.
phone and say pharmacy.
I do answer the phone and say pharmacy, but I think I say like, pharmacy, this is Thu. How can I help
Thu.
you?
Okay,
Yeah.
good.
Yeah.
Full sentences is good.
Yeah, no, not pharmacy. How can I help? No,
pharmacy.
I'm a person. Yeah.
He just said pharmacy. He didn't even say how can I help. He
But
didn't.
see, this is my my insecurity is like, oh, are they saying that to me specifically because my name is weird, or do they say that to every pharmacist?
Oh,
you know what I mean? That's something that I don't know.
No. For some providers, they just don't bother to learn everyone that's on the team. Like, and for us, it's, and I'm just like, no.
Yeah.
I want my name. I want to be called by my name, not a profession.
I have a question for you. Do you, when a doctor, like an attending physician says, call me by my first name, do you call them by their first name? Because
I do.
You do? Okay.
I do. But I always let them lead with that, because even if everyone else around them is calling them by their first name, I always want the permission to come from the provider directly.
Yeah.
I've had
sometimes they say like, oh, just call me by my first name, and I still feel like I want to call them by Dr. So-and-so. I don't know.
Why?
I don't know. It's kind of like my professor. I had this professor that like from the U of A, and he'll be like, call me by my first name, and I'm like, but I can't.
That's hard. Like, one of my favorite professors of all time at school to this day, even when I see her in person, it's always doctor. Like, it's just, and I've told her, I was like, this is more about me than you. It's just your first name. It doesn't taste the same. It doesn't taste the same. It doesn't have the same flavor as when I call you by your last name. That has the right flavor in it. But when I call you by your first, that's no.
Nah.
So she's given up on it. But now I'm experiencing it with students. Like, a lot of the students I help through application, I see them at mid-year and they're like, Dr. Trey, I'm like, Sally will be just fine. Like,
yeah. That's true. Some students do that to me too. And I really, I guess I don't really have a preference. Do whatever you want. Whatever is more comfortable for you. Yeah. Okay. Well, speaking of names, I just want to show this one because at rounds the other day, one of the medical residents called one of our, I think one of our patients or something, Aaron. And I thought that was so funny. And so, have you seen this?
No.
Do you watch Key and Peele?
No. Yeah. Why don't I know any of this stuff?
Oh, Saley. Okay. You have to watch Key and Peele because they are hilarious. This is actually just the shorter version. So I highly recommend you watch the full version because it's hilarious. This is iconic. All right. This is iconic. It's also kind of old, but it's iconic. And it reminds me so much of our conversation about what's in a name. So let's watch it.
Oh, let me see it.
Okay, ready?
Jaqueline.
Do you mean Jacqueline?
Okay.
Oh, and he's the substitute teacher, by the way. So the title is substitute teacher, and he's doing roll call. So let's go back.
Jaqueline.
Do you mean Jacqueline?
Okay. So that's how it's gonna be. Y'all wanna play. I've got my eye on you, Jaqueline. Balake. Yes, sir.
My name's Blake.
Are you out of your goddamn mind?
Blake?
Do you want to go to war, Balake?
No.
Because we could go to...
Saley, are you okay? She's losing it. I can't believe this is the first time you've seen this.
I am not doing this. Jaqueline, I was tolerating that. Balake or Blake?
Balake.
I'm not doing this. No. Oh, but also, look at how he's ready to go to war because they are disrespectful children. I'm done.
Okay, ready? Oh. No, we're not done yet. There's more.
The war.
No.
I'm for real. So you better check yourself. Oh. D-Nice. Is there a D-Nice? If one of y'all says some silly ass name this whole class is gonna feel my wrath.
Do you mean Denise?
Son of a bitch! AA Ron. Where is AA Ron right now? No AA Ron, huh? Well, you better be sick, dead, or mute, AA Ron.
Here. Oh, man.
Why didn't you answer me the first time I said it, huh?
Because it's pronounced Aaron.
Son of a bitch! You done messed up, AA Ron!
Oh man. That was a good one.
Blake is the
Balake.
Balake? How do we get Balake? Oh, but that's so funny because we did a whole what's in a name. And
exactly.
These are all such common names for this society. Why would anyone butcher Denise? I'm done.
Okay, I highly recommend you watching Key and Peele. They are hilarious. They are so funny. I actually kind of started watching them again, and I'm gonna need to send you a bunch of videos on them because
I can't believe I'm that much out of the loop about that. But you did say you consume a lot more YouTube than I do.
Yeah, I do. Sometimes it's just like they recommend it to me, and I'm like, okay, and then I just then it just starts. All right, well, that was all the fun stuff, but when we come back, we're going to watch more of the inspirational, motivational videos. Uplifting to end the episode, and stay tuned. Okay, everybody, and we are back. And now we are going to jump over to Instagram and watch some of these videos that Saleh's been sending me over the past several months. And they're all just like super inspirational.
We want to prepare you to take over the world after this graduation season, wherever you are right now. I hope one of these videos you have it saved and you can play in your head before you walk onto the floor.
Yeah. Okay, let's do this one. We're gonna share screen again. Okay.
Yes.
I don't understand why I'm not moving. I just do my work. I don't engage in all those relationships and all those politics. I just let my work speak for me. But guess what? The work does not speak. You have to put your work in context, and the only way that you can do it is through the relationships that you have.
I think that's it.
This is.
What do you think?
Unfortunately, I just learned this in the last year.
What do you mean?
Like the last 4 years, I've spent it on building, designing, getting a program up and running that was doing exceptionally well, but didn't do well talking about that and promoting myself with that, because I'm like, well, the evidence is right there. I'm saving all these patients all this money. I'm keeping all these people from coming back. Like, the evidence is right there. Like, it's a little gauche for me to be at every meeting boasting about all this wonderful stuff I'm doing. And learning now that I had a responsibility for all of my hard work to create that context so that I did better, right? And it's why I posted about humility, how I felt like my humility hurt my career, but I wasn't going to let it hurt my business. So being more vocal about all the stuff that I'm doing and promoting all the things that we do, I'm not going to be apologetic about that.
Yeah. That's a hard lesson to learn. It's not a hard lesson. It's just like a lesson that's not taught to most people, especially people of color. We're not taught that at all. Yeah, and especially growing up, and you're always just like trying to make sure you fit in and blend in with everybody. You don't want to like stand out. Yeah. It's a hard, not a hard lesson, but a hard behavior to change. I'm glad that we're talking about it now, and we're encouraging others to do the same. So
you have to do that. Document your interventions. Document all the patient encounters you're having that were meaningful. When it's time for your evaluation, write it up. Write up a story about all the ways that you have been contributing and been impactful at this institution. Don't be shy about it, because the numbers alone won't be enough.
Yeah. Okay. Here's this one. You know what's funny is like I don't remember these ones. So I'm almost kind of like reacting to them like you're reacting to the other videos.
Oh yeah.
Okay, let's go.
And Gen Z is saying, here's where I add in. And this is what we have to do as corporations and organizations. It's not about who fits into the culture. It's what's missing in the culture and who adds in the culture. Yes. I believe that diversity, equity, and inclusion is insufficient without belonging, like insufficient without recognizing that everybody, like the science of belonging says that people have to feel rewarded, seen, recognized, and valued in order to feel like they belong. And so I think we see this added on. And so these are the types of competencies and capabilities that are here to stay, even though we get pushback. But pushback means there's progress happening, and the research shows that there's progress happening.
Yeah, that's an amazing point.
Yes.
And I love that you talked about the belonging, because it's less of the quota of diversity, right? It's more than just I'm a data point that potentially represents something.
Much broader than that. It's
so
much
broad.
broader than that.
A little discomfort is good for all of us.
Interesting.
Yeah. Isn't it? Isn't it? Yeah.
Yeah. The belonging component is very fascinating because I think that we can all do a little bit better to help each other feel more like we belong there. Just because, kind of like what they say, just because there's diversity, it doesn't necessarily mean that everybody's being treated equally. And yeah,
it's a very difficult concept for a lot of people to understand. Very difficult concept for a lot of people to understand, like
especially the people who've never experienced like that kind of adversity before. And it's always really interesting because for me, I'm always like, no, like, so let's say maybe there's like some sort of inequity in LGBTQ community or something, and although I don't identify myself in that group, if I do see something going on within that, I would say I'm gonna stand up for those people because you know you shouldn't be waiting for it to happen to you to stand up and do something.
What an idea. Not everyone, not everyone thinks and lives that way though, too. For a lot of people, their scope and spectrum about what will activate them to advocate for change or improvement is their frame of reference. It always begins with self. If it does not affect them, they can be just fine watching the atrocity unfold and they'll sidestep around it, or even worse, they'll encourage the victims of the injustice to toughen up, stop complaining, don't be overly sensitive. They'll do that instead of standing up to the injustice and helping those people advocate for the change that they need. I wholeheartedly agree with, like, I just thought that perspective was really, really great. Like with a new generation saying it's not what's missing, but I'm here to add to it. And so create space for me to be able to bring my unique talent so I can add to this place, because there's no such thing as an already perfect institution. I just don't believe in it.
Okay. Yeah. I agree with you completely. Here is
it's my personal life dream and goals. It's Chimamanda.
Oh my gosh, I don't know who this is. See, I don't know.
Gosh.
I know Key and Peele, but I don't know who this is.
Oh my goodness. Chimamanda she represents a new voice on the continent of Africa that those of us that are from the continent feel the voice has existed for a really long time, but we've had people, but she articulates our thoughts and feelings in a way that we were yearning for so long. She talks about femininity in a way that doesn't position it as a weak thing or even something that needs to be remedied, but it's empowering women and young girls on the continent to think about their wildest dreams and like go after it. Go after it and be unapologetic about not wanting the normal stuff, marriage, children, family, a home. If that's your aspiration, she's like, go for that. But don't shame the woman who's also choosing career. Don't shame her because she's choosing that and putting those other norms secondary. So I love listening and learning from her, and
forget about
it's definitely a
likability.
dream.
I think that what our society teaches young girls, and I think it's also something that's quite difficult for even older women, self-confessed feminists, to shrug off, is that idea that likability is an essential part of the space you occupy in the world, that you're supposed to twist yourself into shapes to make yourself likable, that you're supposed to kind of hold back sometimes, pull back, don't quite say, don't be too pushy because you have to be likable. And I say that is bullshit. And so what I want to say to the young girls is forget about likability. If you start off thinking about being likable, you're not going to tell your story honestly, because you're going to be so concerned with not offending. And that's going to ruin your story. So forget about likability. And also, the world is such a wonderful, diverse, multifaceted place that there's somebody who's going to like you. You don't need to twist yourself into shapes.
What an idea.
That's really nice. Right? Yeah, I really like that.
What a thought that, like, you're so worried that, oh my God, I have to be liked. I have to be liked. It's like you're worried about such a small space, but the world is so big. It's impossible that every single person is going to hate you. Somebody is going to like you. But likability is a cultural thing in Africa. As a woman, you better be likable before anything else. Otherwise, well, you can forget about all of it. And I think like this talk, like when you listen to it fully, people really fixate on this little snippet. I think also because she uses profanity, which is rare. So like this little clip like has gained a lot of popularity. But she was even sampled on Beyonce's song Flawless.
Whoa, that's so cool.
Beyonce sampled a part of a speech. She talks about how women in Africa are trained to be marriage ready, but such a training doesn't apply to men. Right? It's always just
they're not trained to be marriage ready. Yeah.
You're not trained to be marriage material.
Literally the whole world, though, I feel like.
The whole world. No, but I love and admire her courage. I think for a woman who lives there still, to speak as boldly as she does about the things she speaks about, I admire her for that.
Yeah.
Because that takes amazing. A lot of courage to, like to just say like, you don't have to like me, that's okay, but my story, I'm going to tell it with honesty and exactly for what it is. And I'm not going to worry about being liked for that.
Yeah.
That's why I like her.
Perfect.
I know we're on her for a really long time, but it's because I think she's really cool.
I was going to say, like, she sounds so well-spoken. She seems like such a eloquent lady, like elegant, very eloquent. Like she exudes everything that I want to be, basically.
My stomach is literally cramping. Like, I can't wait. You need to send me that video. I want to show it to Henry. Like,
yay. I'm so glad that you get to be exposed to pure comedy gold. I tell you. So like the Chappelle show, Dave Chappelle did his show, and then when he left, Key and Peele took over. Oh. And they have an entire years worth of comedy stuff. They're amazing. Have you ever seen Get Out, that movie? The scary kind of movie? Yeah. So I want to say it was Key or maybe Peele. I'm not sure who, but one of them actually edited or wrote and directed that movie. So that's why it's a little bit of like comedy, like dark humor or whatever.
Yeah. Interesting.
They're really cool. Anyways, well, I really enjoyed this episode. I'm so glad to see Saley having so much fun that she almost peed in her pants.
I really did. I'm like, I can't. If I see a pharmacist in the lab coat, I'm just telling you, what a drag queen you are. I see you showed up in full drag today. You showed up in full drag today.
It is wild. Okay, well, thank you so much, everyone, for listening. And joining us on this fun episode today. This was such a really great way for us to share some of those weirder pharmacy stories that may not fit like one of those typical episodes. But if you enjoy this episode and it speaks to you, please share it, because we need to share the love, we need to share the laughter and the inspiration for our community. So yeah, please help us grow and do that, please.
This episode is available on YouTube, Spotify, or Apple Podcasts, or wherever you can connect. And definitely she'll connect with us on all of the socials. Thu will link all of the destinations below this episode. We appreciate and love all of the support we've been getting so far and want to continue that. Don't forget the new LinkedIn group that we are growing, a safe space and community for everybody to interact and support one another. Until next time, don't forget, we got this.
Bye,
y'all.